And of course, since we are talking about recovery community centers, what we always like to do is have a live feature to start us out, to ground us in what are we actually talking about. And we've also learned that recovery community centers are all different. There's no two alike. Today, we have with us Oliver Birchwood Glover, who is the program director of a Trilogy Recovery Community Center. And he's going to tell us what happens when you walk through the door of his RCC. Oliver, over to you.
Good morning. Thank you for the invitation and the opportunity to speak with you all. So Trilogy Recovery Community is a grassroots peer-led organization that began about 12 years ago. We initially focused on teens at risk, and while frequently substance use was involved, there were a range of social emotional challenges that the kids were dealing with, including legal involvement. And over the years, we've come to include the adults as well. So we do quite a bit of outreach. We do a lot of work at the schools. We have a large geographic region, but we're a very, very small agency with 2 recovery coaches and 2 mental health individuals, and then also a recovery navigator on site, where we have a full-time student assistance services program. So we're pretty small. One of the things that I love about our agency is that everybody sits at the front desk to greet people, and everybody takes out the trash. There's very little hierarchy within the agency. And when we talk about a recovery community, that's really how it is. I talk with staff about, we have to think of ourselves as a village and as a therapeutic village for each other, as well as the individuals coming in. So you might see me at the front desk. You might also see a 17-year-old individual who is on a learning how to work internship at our front desk. You might see retirees sitting at our front desk. You might also see one of our recovery coaches or one of our student interns in a graduate program. And so everyone's welcomed and brought into the agency. It's a small office with long hallways and rooms, but we've worked very hard to make it a welcoming environment for everyone. So we offer to the community 7 recovery and mutual support groups, some with mental health as well as substance use themes. We do that as a community service at no charge to anyone participating. So we have direct service for enrolled individuals, both teens and adults and family members. And then we have our community service groups. And we do a lot of psycho ed interventions at the schools. So